Hello, I'm David Walker, Chair of Oxford Health NHS Foundation Trust. We aren't able to hold fully public meetings of our board, though a representative of the Council of Governors was able to attend the latest this week. I'd like briefly to run over our discussions. Referrals of patients to the Trust are still below their pre-COVID levels, but all the indicators suggest there will be increased demand for services. Other trusts report a high incidence of mental illness among men, and we expect a bigger call on our psychological therapy services. We're doing what we can to anticipate those, and we're keenly aware that some services, especially for children and young people, fall well short already of what we want to provide and what parents and young people need. Because COVID is still around, we're thinking ahead to the autumn and winter. One thing we have to do is prepare to push up ordinary flu, vaccination rates among the public and especially among our staff. COVID threw previous plans and assumptions about finance into disarray. But most of our expenses have been covered, and for the time being at least, the Trust is breaking even. We do want, however, to expand mental health services in line with demand, and are trying to reconcile the sometimes conflicting messages we get from the NHS Centre about expanding spending and from commissioners who pay, or not, for our services locally. Board meetings usually make time to hear from someone who uses our services or from a staff member. At the latest one, we heard from Susan Palmer from the Hospital at Home service in Abingdon. This looks after people in care homes and those who otherwise would have to be sent to the John Radcliffe. Susan and colleagues are only now surfacing from 4 intense months, often harrowing, sometimes dangerous, but leavened by humour and heartening examples of patients' recovery. Oxford Health, like the rest of the NHS, is responding to Black Lives Matter and closely examining how our staff are treated, how open we are to diversity, how aware we are of the hurt and unhappiness felt by some colleagues from Black, Asian and minority backgrounds. We recently adopted a framework for change, but have a long way to go.